Your bookmark. Today we are joined by Dr. Marco Briceno, the Deputy Chief Health Officer of the Northern Territory, to talk about the latest health update in Galiwin'ku. Welcome, Marco.
Thank you.
Yeah, good to have you here. The first question we've got is, could you please tell us what is the current situation in Galiwin'ku?
So, Maya Tali, I just want to make sure that you also know, and listeners, that I am also the Director of Medical Services for East Arnhem Regional Health Service. I have lived in Nhulunbuy for a long time, many years, and I have visited Galiwin'ku many times, and also have strong connections with Yolŋu country and Yolŋu. So I got two roles. One is in the Chief Health Officer role, assisting with the COVID response across the whole of the Northern Territory. But I also have a role in East Arnhem, particularly now focusing in the situation in Galiwin'ku. So the situation there, as you know, started just under 2 weeks ago when we had our first coronavirus case. And we started testing more broadly the community, and we started finding more cases, and then we started to help people to isolate, quarantine, either at home or in the Martakal hotel. And then, unfortunately, the cases spread very, very rapidly. And at the moment, we know about 118 cases that have been diagnosed since the last couple of weeks, of which 66 are still in Galiwin'ku. We have been able to transport some of those cases into Howard Springs. We have some of these people have already recovered, but we keep working hard in community to find those cases and to try to slow down the spread, which has been quite challenging. And we're working very closely with our partners in Midwest Health, but also with other government agencies on the ground, and some people from Nhulunbuy and some people from Darwin, and sending some teams there to try to assist.
So, nalpennan Dr. Marco mawangayara.
Bilanya me 2 weeks ago, then Yolŋu Radio ka rangam radio COVID-19 go, then mang tu man Yolŋu radio min pala ju una then lin pala Martakal motelin. Jinang bala nan COVID-19 ma radio bulang tu na Galiwin'ku ka 118 na Yolŋu radio mim. Pokulong tun danal ka wangay manapan mi. Tangora emergency response team miwait ngro ka anti-government agencies ngro ka Yolŋu ka balanda Nhulunbuy ka Darwin ngro.
Back to you, Dr. Marco. So maybe if you could just explain a little bit more about that. So you mentioned that you're partnering with Midwest Health there and also other organisations. So, there seems to be a lot of Balanda people arriving in Galiwin'ku in the last couple of days, and we've heard for the rest of the week. What are they actually doing there, those people who have come over from Darwin to help with the COVID situation?
So we have a number of priorities. We want to work with Yolŋu people in Galiwin'ku and with the elders and with the broader community to achieve. Our main goal is to try to slow down the spread of this virus among the whole community and going into homelands and going into mainland.
So, nalpennan Dr. Marco mawangayara.
Ngayam banangakul na pianan niwangan. Pandalang nga pakip marangarong abalam, Galiwin'ku lim, kuka yun daw, talin yung lulungon. Karang banging araw tun, tanal, mananaro panaya, really ba na COVID-19, yakka, parkwali, muna ba ma Galiwin'ku community, ka Galiwin'ku homelands. Mananaro yakka makayandili, parkwali.
Back to you, Dr. Marco. Could you please explain for listeners what happens if a Yolŋu person tests positive for COVID in Galiwin'ku, and also maybe just talk about why some people are being sent to Howard Springs, and as you said, mentioned before, there's only 66 people who are still there and who haven't been sent to Howard Springs, because there's quite a lot of confusion and mixed messaging, so it'd be great just to hear from you.
What we want is to offer people in Galiwin'ku and in any remote community the best possible care that they can have as closer to home as possible. Now, if that can be done in Galiwin'ku, we don't want people to live there. The second component of the question is for them to answer is, can I safely stay at home for 7 days and not mingle with anyone else in the family or anyone else in the community? Can we put you somewhere else where you can do that safely? Can we organize a room for you in the Martacal motel? Or will it be better that you come to Howard Springs and spend those 6 or 7 days here, and we will care for you here while you stay away from family and you don't give it to family?
So, well, nalpennan Dr. Marco mawangayaga.
Jina ko danalya kajan mim dukkaum punga health department ngorum kadar kayun panya yulngun COVID-19 min nawununo jalmi miaka nunu ngaro nyina jinal baima martakal motel nga o pala Howard Springs le.
Back to you, Dr. Marco. Are there Yolŋu people in Galiwin'ku that we can talk to if we have any questions, like such as Miwaj Jama Mimala or other government officials that are there? Like, who do we look for? How can we contact people whilst we're in lockdown to ask these kind of questions too?
Yes. So we have the normal Miwaj team on the ground, the doctors in the clinic, Dr. Lou and Dr. Kate is coming back soon, and we got the nurses there. And in addition to that, we have sent some teams from down, and there is a person that is the leader of this team. His name is Sean Taylor. Sean is an Aboriginal man, and he is the leader of the rapid response team that we sent from down to help Miwaj and to help Galiwin'ku with this response. So Sean will be a very good person to talk to, and Sean has a team of people that have gone with him. There is a young man, Stuart McGrath. I'm not sure if you know Stuart, who is also a part of the team, and Stuart is a Yolŋu speaker. And there is also Jamie, Dr. Jamie, who is also a Yolŋu speaker, part of the team. So there are many people that can help with that message in language and that message to be delivered in community.
So, well, nalpennan Dr. Marco mawangayaga.
Pananu jar pulungu tumarawo tao nunu arawanga jina kulwara ulukam.
Miwaj people at the clinic, Dr. Sean Taylor, Rapid Response Team Bungwa, Stuart Ewart McGrath, Dr. Jamie Mapleson. Well, thanks very much for giving us that COVID update for Galiwin'ku today, and be great to have a chat to you again sometime in the near future as well.
Anytime, Atili, and to all Yolŋu people. So,
Nama.
Yo jujut na.
Well, na no final message.
Jaka nung warum balum kamayang COVID jakjin beli tangom ready COVID-19 ma. Nung arumur kait na yan na rediktun urakunjin. Kamayang dangu daum kayak kamayul tuam markap mewana.